I am, as Lizzie said, in the Baltimore-Washington area, so coming to you from the mid-Atlantic US today on the lands of the Piscataway people, among many others, but that's where I'm joining you today. And I thought it would be nice to, given what brings us all together here today, just begin with a few mindful breaths together, just to get completely present. So if it suits you, you're welcome to close your eyes or otherwise turn your focus inward. And I invite you to draw in a nice full inhale and allow a long, slow exhale. And just 2 or 3 more, just like that at your own pace, whatever full means for you right now. Breathing in and breathing out. And becoming fully present so we can explore together today. So I noticed in the chat a lot of folks who are already yoga teachers, and I did see some of my yoga therapy colleagues in there. And I think we'll be covering a lot of information that'll be of interest to all of you. But as Lizzie said, it is my intention to leave time for questions at the end. So let's dive right in. And also, as Lizzie said, I just want to preface everything that I'll share today with the understanding that I'm speaking from my perspective. I wear a lot of different hats. So I'm coming from this perspective of the editorial director of the International Association of Yoga Therapists. I'm also a yoga therapist myself, although I don't practice all that much these days. And I do co-own an integrative health clinic that has a yoga studio. So I'm wearing all of those hats as I'm speaking to you today. And so again, just want to begin by thanking Be Yogi for providing this forum for us to all get together and explore and learn. It's really a pleasure to be here. Our agenda for today is to talk about what is yoga therapy. I saw somebody in the chat was interested in what the heck is this anyway. So we will begin by defining yoga therapy. We'll talk about where yoga therapists are working today, which really helps us to continue to define this profession, which is new. It's new and emerging in the West. And just, when I say it's a new profession, C-IAYT has been around for 35 years. You might be thinking, well, that's not all that new. But in terms of an integrative health profession, 30 years, 35 years is not that long. And of course, there were pioneering yoga therapists doing this work before the founding of C-IAYT, and many of them went on to be founders of C-IAYT. But we're pretty new in terms of the healthcare landscape. So we'll start with defining yoga therapy, continue on with talking about where yoga therapists are working today, and then we'll delve into the practicalities of becoming a certified yoga therapist. So, yoga therapy includes all of the practices of yoga. And the practice of yoga, of course, includes not just the physical postures or the movement, the pieces that many people in the West are familiar with, but it also includes practices that address every level of a person's mind, body, and spirit, and practices that work with every level of a person's mind, body, and spirit. So yoga therapy is all of these things. It's not just super fancy asana, right? It's all of the practices. Because yoga itself is a comprehensive methodology for the care of the whole person. You might recognize this graphic, which I love because it shows the interlapping, interwoven layers of what yoga is. And this is essentially the Panchakosha model. These layers are inseparable, they're interrelated, and what we do in one of them affects all of the others. So if we're doing a breathing exercise, we're going to affect muscles and physiological processes in our physical body, in Anamaya, the Maya Kosha, right? And we'll also experience changes in our mental and emotional state. So we're not just affecting our lungs or our respiration with that breathing practice. Likewise, if you do a physical practice, you're affecting your mental and emotional state, and affecting your breathing, and on and on. So yoga therapy is, this is C-IAYT's official definition. I'll give you a second with it. And on IAYT.org, there's more detail. There's a longer definition. It's a full page that breaks it down a little bit more. But this definition gets a little heady. There's a lot here. So let's break it down a little bit. The professional practice of yoga therapy includes all of the mind, body, spirit practices of yoga. We could arguably add cultural in there as well. It's offered in the context of a therapeutic relationship. So that's really important, that container, that therapeutic container that we bring to the practice. And it involves individualized assessment. Even if you're working in a small group, we might talk a little bit more about that later. It involves purposeful care planning and record keeping. So things like soap notes and very careful, purposeful record keeping. It involves therapeutic goals co-created with clients. This is not a practice that you're imposing on someone else. It's very much a co-created practice that we do together with clients. And it includes lifestyle management support. And all of this is in service of promoting health and well-being for individuals or small groups. So becoming a yoga therapist, it starts actually off this screen. It's not in this graphic. It starts with being a curious person. And that's what leads most of us to become yoga practitioners, right? And then you will become, at some point, a yoga teacher, and then possibly a yoga therapy student, possibly a yoga teacher who uses practices therapeutically as you're working as a yoga therapy student. And then eventually you might become an C-IAYT certified yoga therapist. So we'll come back to those steps in a little bit more detail in a bit. Where do C-IAYTs work? This is really an exciting portion of the program for me, because learning about where C-IAYTs, so C-IAYT is, as Lizzie said, I think C-IAYT certified yoga therapist, learning about where C-IAYTs are working can really help us to see what's possible. And we're just going to look at just a sample this afternoon. There are definitely other places that people are working. This information is from recertification data that we gathered during 2022 and 2023. So it's a small sample size, but it does give us an idea of where people are reporting that they are working. It's an entrepreneurial field, right? We said already that it's emerging in the West. It's pretty new. And one of the things that means is that most of us are practicing in more than one setting. So this graph can be a little bit challenging to read. And I tried to color code it for you so it would be a little bit easier to see what's going on. But most people reported that they work in more than one setting. You can see at the bottom that starts simply with their primary place of work is in their studio or an office in their home. And then a yoga studio outside the home. And then we start to move into people who said, I do multiple things as my primary activity. And you can read those for yourself. And I will try to make these slides available for you in case you want to have a look at them in more detail later. Other You'll see that there. That could be things like community centers. It could be prisons or jails. In another question in this same survey, we asked whether people were offering virtual sessions. And most C-IAYTs are doing at least some online work at this point. So where are they working and what are they doing? Similar to the graph on the previous slide, people chose multiple options. So I just, to make this one a little bit easier to digest, I color coded it and left the numbers off. But you can see that this is the primary activities that people reported that they were doing. So the items at the top in the navy color are what we might consider when we first think about yoga therapy proper. So yoga therapy with individuals, yoga therapy with small groups. And then we've got sort of educational activities in green, yoga therapy retreats, and then research and publications there in the light blue color. So now let's look at some actual yoga therapists in action. And these examples will help us to understand more about what yoga therapists do. So you might think people tend to have one of two reactions when they learn that they learn about the existence of yoga therapy. They might picture what's happening on the left, so people in a hospital, or that might not occur to them. So depending on their perspective, they might be really surprised to learn that some of us do work bedside in hospitals and other healthcare facilities. There's a lot more to it though than just these settings. So on the left is Kelsey Kramer, and she is working at Indiana U Health. And another setting where yoga therapy is taking place bedside. This is pre-pandemic, so I don't know if they've managed to restart this program, but Maryland University of Integrative Health, one of their clinical practicum settings, which we'll talk about in a little bit, one of their clinical practicum settings was in the med-surg ward and an oncology unit in a local hospital. So the student interns were going into that setting and providing yoga therapy bedside in a hospital. And I was privileged to be one of the clinic supervisors who was taking students into that setting. And we weren't doing any asana at all, right? So we have to move away from this idea that yoga equals physical practice, or it has to equal physical practice. So that's another setting where the bedside yoga therapy was taking place. On the right is Dr. Ingrid Yang. She is an MD and a C-IAYT, and she integrates yoga therapy into her practices. Yoga therapy is also really integrated into the Swedish hospital system. The last time I talked with the person who had really spearheaded this, the practice was in, I think, 25% or more of hospitals in Sweden had a yoga therapy offering integrated into their care. It's being integrated into the National Health Service in the United Kingdom. And then in India, which I'm not really going to talk about today, it's a whole different ballgame. There are entire hospitals dedicated to yoga therapy and related practices where you can check yourself in or be checked in and have weeks or even months worth of dedicated care, including yoga therapy. We're not quite there yet in the West. A couple of other healthcare settings here for you. This is Judy Barr, and she's really a yoga therapy pioneer. In the larger photo, she's at the Cleveland Clinic. You might have heard of that, leading a therapeutic group. And then on the right was just a couple of years ago. The bigger photo is a little bit older, but it's still a good one. And then on the right, she was at an American Hospital Association ceremony, giving folks a taste of yoga therapy practices. Yoga therapy is also offered in the Ornish Heart Health Program. You might have heard of that. Another yoga therapist I don't have a photo of is Smith Malaya, and she works in a cancer hospital. And in that cancer hospital, she supports not only patients who have these life-threatening illnesses, but she also supports their caregivers. And a lot of yoga therapists are doing that work as well. The cancer-specific hospitals and settings tend to be offering a range of complementary and integrative practices. In a lot of ways, they're on the forefront of really bringing those things into the fold. And a lot of them now do have yoga therapy programs of some kind. So not just MD Anderson, which is where Smitha works, but also Memorial Sloan Kettering, University of Maryland. Some of their facilities have these programs. The VA, the Veterans Affairs Administration, and military settings. Another place that you'll find yoga therapists working today. Yoga therapy aligns really well with the VA's whole health model, which you might have heard about, is this systemic approach, this integrative approach that has a lot in common with the Panchakosha system. So yoga therapy fits in really well, and it is included in the core menu of services that are to be offered to veterans seeking care in these facilities. So that's a really cool development. There also is about to be, or I'm not sure if it's actually live yet, but the VA has a professional classification now for yoga therapists. So stay tuned for more information on that. I don't have all the details on that yet, but that is coming. In that center picture is Noriko de Guzman. And on the right is a practice that's being led by Kim Richardson, who does a lot of really varied work. She's going to come up a little bit later too, but she works often with veterans as one of the populations she works with. Yoga therapy is also being offered in other military settings and in health promotion contexts. So on the left is Melissa Aguirre, and she has, both of the folks on this slide are military spouses. And Melissa has become really adept at bringing practices into settings where she gets to talk about them, right? So she's not necessarily offering yoga therapy here, but she's talking about whole health and bringing that yoga therapy context in. On the right is Joey Moore-Holt and his husband. And Joey works with LGBTQIA+ populations and supporting those folks in military settings. So pretty specific, but it's also still yoga therapy. Yoga therapists often work in community and senior centers. So remember I said on that previous slide, other could include settings like these. On the far left is Tung An Pham, and he works in Vietnam, and he works in a number of different settings. Top center is a photo from Laura Liu, and she works in Chinese enclaves. I believe she's in the San Francisco area, but she works with relatively recent immigrants. And these are folks who need a lot of support. So she's providing not only targeted yoga practices that address the needs of these folks, like healthy aging practices that will support physical health and cognitive health as they age, but she's also connecting people with health literacy resources and getting them connected with other kinds of healthcare. So it's again, it's quite specific to the need at hand. Bottom center is from Mimi Felton, who offers community-based programming in the Atlanta area. And then on the right is Dr. Marilyn Peppers Citizen. She's at the back of that photo. And she works a lot in community centers and senior centers as well. I've alluded to this already, but yoga therapy really is wonderful for working with specific populations because it is by nature individualized. It's completely personalized. And it doesn't always take place in what you might think of as a yoga space. On the left is a photo from Beverly Lockhart, who works with folks post-incarceration. And so that, again, it's a really specific need really specific collection of needs that these folks have. So she's often working with unaddressed trauma. She's working with the physical results of people having been imprisoned for years. So very specific stuff. And I believe that second photo in the middle, that's also from one of her programs. And, she's offering the practice where she can. It's on a bare concrete floor, and in a community center type setting. Shawandra Ford works with young athletes. So that photo on the practice field is from her. And she also works with people in prisons and detention centers. Had to show you this photo because it really underscores the idea that we're working where we need to work. So these two photos are from a yoga therapist named Gina Barrett, and her organization works at the US-Mexico border and at other sites as well with recent immigrants. And these are often folks who are fleeing oppression and violence. And again, you can see that the skill set needed to work safely with these people is probably pretty different than what you would get in a 200-hour yoga teacher training or a shorter course. A lot of yoga therapists have started nonprofit organizations. It seems to lend itself to that kind of outlet. On the right there is a young boy who came from, I believe he came from Haiti with his mother, and they endured all sorts of horrors on their way, eventually did land in the United States. And he's here not practicing in a yoga class. He's doing this totally on his own at some point after class because he discovered that the practices made him feel a certain way and provided a certain benefit that was tangible to him. So he's practicing here totally on his own. I think it's just a beautiful picture. And these images are also from Casa de Paz, which is Gina Barrett's organization. And again, you can see they're providing the practices wherever they can, whether it's in a mobile unit, in a sort of a parking lot, or on a playground. Yoga therapy is also offered in organizational settings. Organizational well-being is big right now, and it's going to be bigger as companies really understand the idea of supporting their workforce in different ways. So yoga therapy can definitely be a help with that. And having the credential and being able to point to the training really helps to open doors for a lot of yoga therapists. So on the left, these actually both are from Tina Paul, who is on staff with C-IAYT, and she's also a faculty member at Maryland University of Integrative Health. And she's also doing these other activities. So remember, I said a lot of us wear a lot of hats, which makes it fun. So if you enjoy that kind of dynamic work, then definitely might want to consider a career in yoga therapy. On the left, she is, I believe, at the New York City Department of Health and Mental Hygiene, offering a practice. And you can see she's got everybody feeling their rib cage and doing their pranayama. And on the right, she's at a private firm. I think it was a talent recruiting firm. Another organizational setting that a lot of yoga therapists are working in is in schools. So I mentioned Kim Richardson earlier. She also does a lot of work in schools, specifically the Alabama public school system. Yoga therapists are working online. They work supporting other healthcare professionals, and they are starting to work in selected insurance networks. So as we're thinking about supporting healthcare providers, there's really a lot of work to be done, especially post-pandemic, peri-pandemic, compassion fatigue, burnout, stress contagion. These are real and growing problems that yoga therapy has lots and lots of tools to address. We're working online. We said that already. And there on the bottom right is Jeevana Heyman, the founder of Accessible Yoga, who Lizzie mentioned is, I think, going to be joining for a webinar later this month. Well, really what it comes down to is we're working where we see the need and where our own passion lies. The top two photos are from Mona Flynn, who works with refugees from Syria and elsewhere. And you can see that she's offering her practices in a church basement. You know, again, it's wherever you find the space, you come to the population more often than not. The bottom right photo is from Ita Roussos, who happens to be the program director of one of the newest C-IAYT accredited yoga therapy training programs. And she works in inner city Johannesburg and in townships in South Africa. And here, this practice was being delivered in the commercial kitchen of a school, I think. You know, you could also be working with trauma survivors, with people dealing with addiction, youth with special needs. Those are all populations that a number of yoga therapists have chosen to work with. And again, it's really about where their individual passion lies. So that's one of the things that really makes this an exciting field, an exciting time to be entering into yoga therapy. You get to really think about how it is that you would like to work and how you work best. I've said that yoga therapy is an integrative health profession, so have a look at these basic models for interprofessional collaboration, just to start thinking about how you might like to work. These are sort of basic structures. You could be directly employed. Many of us are at this time indirectly employed, although those actual employed relationships do exist. It's less common right now. So you want to start to think about what job opportunities exist in your community, and do your interests match those opportunities? And if not, how can you work to bring those two things into balance, your interests and the opportunities that are available? But I think you also hopefully have a sense by now, given all those examples that we went through, that you're creating your own opportunities in a lot of cases. It's really useful to think about how you really like to work. How do you want to be in relationship to other people? Do you want to be a teacher and a guide? Or do you think of yourself more as a healer? Would you like to move more in that direction? Because it is a different way of looking at the client, looking at the student, looking at the client. There's a difference between yoga teaching and yoga therapy. I think I had this idea when I first went into my yoga therapy training that yoga therapy was fancy yoga teaching. And that's not necessarily the case. You could be a really good, really experienced yoga teacher and not be providing yoga therapy. So maybe you don't actually want to be a yoga therapist. It is a different approach. Other things to consider are whether you have training or licensure in a complementary field. It's not necessary. So in those surveys that I was showing you earlier with those graphs, about 30% of the C-IAYTs right now are other kinds of healthcare providers. It's not necessary, but it does tend to influence how you might like to practice. And I noticed in the chat, there's at least one registered nurse on with us. So that brings a different perspective to how you might like to practice yoga therapy. And it changes the opportunities that are available to you. Again, it's not essential to have training in another healthcare field. It definitely can be done without that, but just something to consider. Okay. Moving on to the practicalities of becoming a yoga therapist. So this is similar to that continuum slide that we saw earlier. Begins with being a yoga practitioner and a yoga teacher. And these are additive, these steps, right? You don't stop being any one of them as you move through this continuum to C-IAYT certified yoga therapist. My own journey, and probably that of many of the folks who are on today, my journey started as a yoga teacher who wanted more. You know, that I had done 200-hour training and I had done a bunch of other specialized trainings and they were really good. But they did not provide me with a comprehensive education in serving as a healthcare professional. Certainly, they did not prepare me to have that therapeutic relationship that's an essential part. And they also didn't give me methods for understanding and assessing the whole picture of a client's life. So I knew that I needed more skills. I knew that I needed different skills to safely and effectively work with the people who were routinely practicing in my studio, which was older people, folks with musculoskeletal injuries and other concerns, people dealing with PTSD, arthritis, anxiety, depression, diabetes, cancer, you know, all of those things that really are present in all of our classes on a daily basis, whether we're conscious of it or not. So all yoga therapists begin as yoga teachers. And to enter an I-AYT accredited program, you have to have at least 200 hours of yoga teacher training, at least 1 year of teaching experience, and a regular personal practice. And the formal educational standards require a minimum of 1 year for that practice. The first three are requirements, but it's also a really good idea to experience a yoga therapy session for yourself. And you can find find a yoga therapist for yourself on I-AYT's site for the public, which is yogatherapy.health. So check that out. That site has some other information that you might be interested in as well, but check it out. So continuing to get the lay of the land in preparation for perhaps entering a training, events like this one are a great start. Consciously connecting with other people who are doing this work. Join I-AYT if you haven't already. I-AYT is the largest international association representing the profession. And there are others which I-AYT maintains relationships with. And I've listed 3 of the ones that are currently most active on this slide. I recommend reading I-AYT's publications, not just because that's what I spend my days primarily doing, but read the publications once you join, because those are a benefit of membership. Learn more about the ins and outs of yoga therapy practice and familiarize yourself with the research that's happening. And I also recommend that you attend the annual conference, the Symposium on Yoga Therapy and Research, SITAR, that's held every June. And when you're at that conference, you can talk to experienced yoga therapists. You can meet experienced yoga therapists. It's a small enough conference. It's an intimate community that you'll get to talk with these people, as well as with graduates and faculty of the training programs, so that you can really start to delve into which training program is the right one for you. So when you go to find a yoga therapy program that's accredited by I-AYT, those are all listed on the website on iayt.org under accreditation. And all of the programs listed there meet I-AYT's accreditation standards. But each emphasizes the tools and the practices of yoga in its own way. So you really get to choose what is going to be best for you. Some programs focus more on the mental or spiritual aspects of health and well-being. Others devote more time to research, philosophy, or other aspects of the practices. And some of them are lineage-based. Not all of them, but some of them are lineage-based. So it really is all about finding the right program fit for you. Consider which learning style and location, including whether you want to be online, will work best for you. Do you want that academic approach? You know, then maybe you want one of the university-based trainings or another program that takes a more academic approach. Are you looking for more of an ashram style experience? And again, some schools offer some or even all of their programs online. Another plug for reading the I-AYT publications. In Yoga Therapy Today, the magazine, we run profiles not only of individual yoga therapists, so you can see what folks are up to, but also of the training programs. Also read the ads, because the accredited programs will often run ads in the magazine. And you can learn a lot from there. You can learn a lot at Sitar at that annual conference. Ask if you can sit in on a class at the schools that you're seriously considering. Once you've narrowed it down to a couple, ask if you can sit in on a class, and whether you can talk with graduates of the program directly about their experience. It might not be possible at all schools, but you might then, in that case, ask to meet with the program director in person or online. And then you'll complete your training. Next step. Check. Easy, right? So I-AYT accredited programs are at least 800 hours long, and they take place over a minimum of 2 years. And that's so that you can really embody the information. You could complete 800 hours of training in far less than 2 years, but the standards mandate that it's going to take place over at least 2 years. And many of the programs are actually longer than 800 hours. All of them include courses in yoga-related anatomy and biomedicine, philosophy, therapeutic skills, and professional practices. I mentioned the clinical practicum a little while ago. All accredited programs also include mentored clinical practicum experience. So that's where you actually get to work with clients under the guidance of experienced yoga therapists to really start applying your skills. After you've graduated from your accredited program, you can apply to become an I-AYT certified yoga therapist, a C-IAYT. You'll need to be a current member of I-AYT and to agree to abide by the organization's code of ethics and professional responsibilities and the scope of practice for yoga therapy. And there's a short online quiz just to verify that you are familiar with those documents. And those documents are something that really does set this field apart. It sets you apart as a C-IAYT, and it lets people out in the world know about your commitment, your experience, and what you really bring to the table. And the application itself is simple. And I would say that, when you're taking this step, to remember that you're really contributing to the professionalization and the growth of the field when you make the commitment and take that step. And then you'll begin your career as a yoga therapist. So especially as people become more interested in taking charge of their own well-being, and as healthcare providers and health systems become more attuned to biopsychosocial, spiritual, and cultural health, and they become more attuned to patient-directed care, I think that makes yoga therapy a more and more exciting field, and it certainly sets us up for more growth. So you'll have lots of options to shape your own career. So in my yoga therapy business, when I was more active in that part of my professional life, I would work with clients one-to-one, including telehealth. I led small therapeutic groups, so groups of people with a similar condition or concern or life stage. I offered educational presentations, including for yoga teachers. And then I really started using my knowledge to complement my existing skills as an editor and writer. And I think I mentioned I also worked as faculty in a graduate program and as a clinic supervisor. So the possibilities are really endless, and it can be done, not just in big cities. You really can create your niche and do this work in a satisfying way. And I think the niche or specialty area that really interests you directly affects your earning potential. So that's something to think about. And also creating that niche is something to think about. It will be a lot easier to target your professional development, to target your work, if you're doing something more specific than, I think we all want to offer the practices for everyone. But if you're able to zero in a little bit more on what it is that you do, I think that will that will be really helpful. And again, these questions to ask yourself. Do you like being up in front of a class? Or do you really prefer that more intimate environment, the one-to-one work? So as an emerging profession, we still hold ourselves to a standard that is fitting for a complementary health field. And that really involves new skills and new ways of thinking for most of us, right? I think I said I didn't have the skills to develop and maintain a therapeutic relationship when I was a yoga teacher. Despite the good training that I had received, it was not about creating a therapeutic relationship. So that's just one example of the different mindset that you bring as a yoga therapist. Different skills, different way of thinking for most of us. We are right now a field that's walking this path of what we call responsible self-regulation. So that means that we all have responsibilities to uphold our professional development, to uphold our standards as we practice. So I would love to open it up to questions. And before I do that, hi, Lizzie. Before I do that, I want to make sure you know how to get in touch in case you have a question that we aren't able to answer. If you go to IAYT.org and the top, it's going to be in the top or the top right of every page, there's a link that says contact us. And if you submit your question through there, that page also contains a list of frequently asked questions. But if you submit your question through contact us, we'll answer it promptly. But that's the best way to make sure your question goes to the right person, because we're a small team, so we can answer quickly, but we do want to make sure that the right person answers the question.
Yes.
Get the best
And any questions we do not answer, I'll make sure, Laurie, I'll send them over to you and your team, and we will do our best to get those answers. But we do have some questions that came in, and thank you all for a very engaging time. It was really fun to watch everyone interact and learn from each other, especially people providing their own experiences and find how they found people. So a few questions that came in. Well, before we get into the questions, I just want to really reiterate the point about there's so many different pathways to get to the right choice for you. And I think having conversations within your community, within your studio that you go to and things like that, to open the doors to those types of possibilities, I think that is a really key component to finding a job that makes sense. And it's potentially just creating that opportunity in the community. There might not be one that exists currently. And it's just amazing to hear all of the different examples. Thank you, Laurie. I'm inspired.
Yeah, and a great example that I didn't bring forward, we might think, oh, that opportunity is not there. They don't have yoga therapists on staff. A lot of places are not likely to have yoga therapists on staff yet. A lot do, but there are still a lot that don't. And so what people have done is they get involved in that particular community that they want to work in different ways. They attend support groups, they offer talks to the support groups, and they really establish relationships. And that's one of the ways in, and it takes time.
Yeah. All right. So let's jump into a few of these questions. So Stephen had a couple, and one of the first ones he asked was, there's so many different yoga therapy programs out there. How can I find the one that best fits me?
Yeah, it's a great question. And as you said, there's not one path, there's not one program probably that's going to be exactly right for you. But I think it's useful to start with that list of questions, to think about what approach you're looking for. So sometimes people think, okay, my original teacher training was really physically oriented. It was anatomically based. So I probably need a yoga therapy training that goes down that path as well. And that's one approach. You might take the opposite approach. You might say, I want one that really focuses on meditation, that really focuses on the subtle body, the non-physical aspects of practice to complement that existing knowledge. And I hear that from healthcare providers a lot too. So if they maybe are a psychotherapist, then they might go and do a more physically oriented training. So it comes down to the focus. They're all going to cover the basics. They're all going to cover material that meets the educational standards. So you will get that education no matter what, if you're going into one of these accredited training programs. But how do they do it? And does that resonate with you? So I really think it's important to talk with the program director, to talk with graduates if you can. You know, a lot of people narrow it down based on those practicalities. Can I, if it's going to be like a weekend format where I have to be away for one weekend a
Mhm.
month, can I do that? Does my life accommodate that? Or do I need to look for something else? And at this point, there are more than 70 accredited programs. So yeah, there are a lot to choose from, and you probably can find something that does work with your schedule and your learning style.
Mhm. And in the webinar recording email that will be sent out, we'll send out any links. So the list of the accredited programs, things like that, we'll make sure are in there so you guys can continue to do your research. One of the programs that was brought up by a few different people was MUIH, and something about they're potentially going fully online. Is that something that's still developing? And can you tell us a little bit about their program?
I'm not directly involved with it's Maryland University of Integrative Health, and they were recently brought under Notre Dame University. So I'm not directly involved with them anymore, but it is my understanding that their program is at this time going online. So yeah, that one is going to be completely online
Yeah.
for the time being.
I know I recognize their name from Sitar because we have attended as well. So they're great people and definitely contact them if that suits you. All right, another question that came in. So Danielle, thank you first of all for sharing your experience. If everyone takes a minute to read her chat, I think you should do that. But one of her questions that came out of it, she says, I'd like to contribute to the research area of yoga therapy and writing contributions related to publications. Thoughts or advice to connect and contribute to advancing research?
I love that question. So my first thought is to attend IAYT's dedicated research conference, which is the Symposium on Yoga Research. That one happens every fall. This year it's going to be October 14th through the 16th, I think. And it's been held at Kripalu for the last number of years. This year there is an online option. So you can live stream it. You don't have to go in person. So that makes it a little bit more accessible. But that's the place to go to really start to get the lay of the land of the research and to connect with the researchers. It's a smaller conference, very intimate, and the researchers are just so gracious and so willing to talk with everyone. I think you'll find it to be a great experience. Now, I don't know how that's going to go online, but I think you'll still have opportunities to connect. So I think it'll still be a worthwhile experience. And then join IAYT and read the journal. So you can read, we have at least one open access article every year. So you can get that on our website as a starting point. But the International Journal of Yoga Therapy is one of the more respected peer-reviewed journals in the space. So see what's happening there. And those are my two recommendations. You can also look at where the researchers are coming from when you read their affiliations on the peer-reviewed articles, and you'll start to get a sense of which universities and institutions support research programs, and you can reach out to those researchers directly. And in most cases, they're going to be happy to talk with you as well.
Mhm. Lynn had a few questions, and I will say, Lynn, I think the best way for your question number one around organization of the different programs would be great to submit as a contact request to the C-IAYT. But your second question, programs seem very expensive. Do you know of any grants, subsidies available, or are they available in certain circumstances?
Yes, they are. So depending on what kind of institution the training is being delivered through. So in a university setting, often traditional financial aid is available. A lot of the smaller yoga therapy training programs do maintain scholarship funds. And there often are some sort of grant funds available as part of the program directors and the founders seva. So ask, narrow in on the training that you want, figure out why that's the one you want, and then approach those folks.
Mm-hmm. I'm just going through the chat to make sure we've covered our bases here.
And I see a question in the Q&A from Priya that I want to make sure I answer because I missed it in the presentation. One of those steps in becoming a C-IAYT, once you finish your training, is to take the certification exam. So this is relatively new. It's been phased in over the last few years, but now it is required. So you'll have to take and pass that exam. So it is an international exam that's been developed by a whole bunch of subject matter experts from all different lineages, all around the world. And it was a really extensive development process. So that is now in place. And I think that's what you're asking, but please feel free to type some more in there if that didn't answer your question.
I think she's also asking, are there practice exams available? So before you get to the actual test.
Your program director should have materials study materials, because there is a study guide that's super helpful. Yeah.
Awesome. Well, good. So Elizabeth asks, we'll do one or two more questions and then we'll wrap up. Elizabeth asks, how much are sessions running? So I assume for like a one-on-one situation.
It really varies based on geography. So in a lot of folks are charging, they're looking at what people in their area are charging for massage therapy, psychotherapy, how much a regular general yoga class costs maybe factors in, but not as much, because it's a different thing. So a lot of folks are looking at what others in their area are charging for these other services, and they're pricing themselves in there. Many of us do offer packages, similar to how you would for an individual yoga session. So if you do a 5-pack or a 10-pack, there's a bit of a discount. And one of the promising things is that many flex spending accounts or health savings accounts, depending on how you have your business as a yoga therapist set up, depending on how you've classified yourself, those funds can sometimes be used to pay for your services. So that makes things a little bit more accessible for folks.
Alrighty. Any questions that we haven't been able to answer, again, you can feel free to reach out to with the contact form on C-IAYT, and I will make sure, if we haven't read through all of the questions, I'll send them over to Laurie and she can help facilitate those. Thank you so much for your time, Laurie, and thank you, C-IAYT, for allowing us to do this and sharing a little bit more about yoga therapy to our community. We will send out the recording tomorrow with a list of all the links that will help you guys continue your search. And then I just wanted to mention, and this will be included in the email as well, but there will be a special offer for up until the end of September for $10 off your first year of an annual membership to the C-IAYT, and more details will be in that email, so you guys can check that out. if that makes sense for you. But that's a very special offer, and thank you to the IAYT for letting us have that. Alrighty. So with that, I hope everyone has a fantastic rest of your day, and we'll see you on the next one.
Thanks so
Bye.
much.